Week 4 team assignment. Teen moms. Team members consists of Felita Blackman, Anthony R. Franchina, Tierra King, Catherine Rock, and Cruz Villanueva. Within this presentation, we will be discussing teen moms with a demographic of the United States. While doing so, the topic of discussion are as follows. There is a high teen pregnancy rate in the U.S. than any other industrial country. American teenage girls is 25% more likely to give birth during adolescence. Girls raised in single mother households are at increased risk of teenage pregnancies. Without any optimism for the future, girls may seek pregnancy as a parent and parenting as their life goal. Over the recent years, becoming a teen mother has been an epidemic within the United States and is a major cause of high insurance costs, morbidity, and mortality among society. Since 1990, teen pregnancies and birth rates have declined 51 to 57%, reaching historic lows. Yet among teens between the ages of 15 to 19, high rates of abortion have begun and are now the new challenge of the industrial world. While teen moms can provide their babies with endless love, ideally the number of new teenage mothers needs to be lowered by means of education because teens have poor eating habits and lack of access to medical attention, as well as being subject to low poverty and poor social status. Within the United States, teen moms have higher rates of low birth weights and are at the highest risk for being financially unstable and mentally dependent. Infants born to teenage mothers are at increased risk for a number of health risks. These risks include the following. Teenage mothers are less likely to gain adequate weight during their pregnancies, leading to low birth weight. Low birth weight is associated with several infants and childhood disorders and a higher rate of infant mortality. Low birth weight babies are more likely to have organs that are not fully developed, which can result in complications such as bleeding in the brain, respiratory distress syndrome, and intestinal problems. The teen moms are also likely to pick up bad habits like drinking and smoking. Teenage mothers have a higher rate of poor health habits than older women are less likely to take recommended daily prenatal vitamins to maintain adequate nutrition during pregnancy. Teenage mothers receive regular prenatal care less often than older women, which is essential to monitoring the growth of the fetus and the health of the mother. During prenatal care, medical professionals provide important information about good nutrition and about other ways to ensure a healthy pregnancy. However, this information is usually disregarded. According to the American Medical Society, babies born to women who do not have regular prenatal care are 4 times more likely to die before the age of 1. In addition to increased health risks, children born to teenage mothers are more likely to experience social, emotional, mental illnesses, and depression. These problems may include the following: poor nutrition, health care, and cognitive and social stimulation as a result. They are at risk for lower academic achievement. An increased risk for abuse and neglect. Males born to teenage mothers are 13% more likely to be incarcerated later in life, and females born to teenage mothers are 22% more likely to become teenage mothers themselves. So now we ask ourselves, what has been done for prevention of this epidemic? So far, we know that there has been creation of awareness on the issue of teen motherhood. This has been done in schools, medical institutions, town centers, community halls, churches, health clinics, and referrals to urgent care facilities. There has also been community teen programs to support teen mothers in the U.S. What has been done in communities in other countries? Planned Parenthood is one of the policies that exist. Centers for Prevention. 71% of our clients receive services to prevent unintended pregnancies. The Center for Disease Control launched teen pregnancy prevention in 2010 to 2015, reduced teenage pregnancy and addressed disparities in teen pregnancies and birth rate by community mobilization and sustainability. evidence-based programs, increasing youth access to contraceptive and reproductive health services, stakeholder education. Current and existing policies inform us that we are a trusted healthcare provider, informed educator, passionate advocates, and a global partner helping similar organizations around the world. Planned Parenthood Health Centers focus on prevention. 71% of our clients receive services to prevent unintended pregnancies. This organization has many services geared specifically toward teens. Services include birth control comparison tools, frequently asked questions about sex, STDs, and body changes, relationship information, and available counselors on hand that will talk with the teens. The Center for Disease Control launched teen pregnancy prevention between 2010 and 2015, partnering with the Federal Office of Assistant Secretary for Health, OSHA, to reduce teenage pregnancy and address disparities in teen pregnancy and birth rates. 5 goals of this program are community mobilization and sustainability, which engages all areas of the population within the community in an effort to address teenage pregnancy prevention. Community mobilization supports the idea of teen pregnancy prevention efforts by empowering community members and groups to take action to facilitate changes. Evidence-based programs consist of healthy teen networks in a national organization focusing on adolescent health. Increasing youth access to contraceptive and reproductive health services provides training on supporting clinics and providing youth-friendly and accessible services that are responsive to the stages of adolescent development. Stakeholder education, working with the National Campaign Organization. Their goal is to build grantee community or capacity of education, community leaders, parents, and other constituents on evidence-based and evidence-informed teen pregnancy prevention strategies. Working with diverse communities, raising awareness of community partnership about the bond between pregnancy and social health factors, and in doing culturally and verbally appropriate programs and reproductive health care services are available to use. The outcome of this so far has been reduced teen birth rates by 10% in targeted communities. It has reduced teen pregnancies in targeted communities, increased the percentage of youths who abstain from a delay of sexual intercourse, increased the consistent and correct use of condoms and other effective methods of contraceptives among sexually active youths. They have also embarked on the inform, educate, and empower. Both Planned Parenthood and the CDC offer services that educate teens and provide them with resources to make good choices for their health. Mobilize community partnerships. Engaging teens in workshops and meetings that demonstrate the statistics and resources that will provide support and knowledge to protect them from sexual transmitted diseases and focus on enhancing interpersonal relationships. Develop policies. These organizations have developed steps for teenagers to take that will help them determine if they are ready for sex, birth control options, privacy from parental interventions. The main stakeholders for teen mom prevention include public health nursing early intervention programs, the PHN EIP for adolescent mothers. They are meant to improve the pregnancy outcomes between the young Latina and African American adolescents across the global nation. The other stakeholders is the UCLA School of Nursing, to which are responsible for the education, practice, policy, and patient advocacy of teen moms. With such programs and stakeholders in place, we have seen improvements in child mental health, child development, school readiness, parenting practices, and family economic self-sufficiency, and reduction in child maltreatment, as well as a decrease in the number of teen moms across the nation and the United States. References are as follows.